ਦੇਸ਼ ਦੇ ਵਿੱਚ ਕੋਰੋਨਾ ਦੀ ਦੂਜੀ ਲਹਿਰ ਤੋਂ ਡਾਕਟਰ ਵੀ ਚਿੰਤਿਤ ਨੇ। ਇਹ ਲਹਿਰ ਪਹਿਲਾਂ ਤੋਂ ਕਿਵੇਂ ਵੱਖਰੀ ਹੈ, ਕਿਵੇਂ ਬਚਿਆ ਜਾ ਸਕਦਾ ਹੈ, ਡਾਕਟਰਾਂ ਨੂੰ ਸੁਣੋ।
I'm Doctor Chandra. I'm a consultant physician in New Delhi. I work at Helvetia Medical Center, and I'm also the principal medical advisor to the European Union in India, along with a couple of other embassies here as well. The new mutants seem to be undetectable by the RT-PCR tests. For some reason, the RT-PCR tests are not being able to detect all of them. I do believe there are double mutant and triple mutant varieties that have been discovered, and it's possible that because of their change in their structure, the RT-PCR tests are not able to detect them. I do believe genomic studies are also going on to find out any newer varieties which are available at the moment. The newer variety seems to be causing some new signs and symptoms as compared to what we saw in the first wave. We are now seeing patients coming with diarrhea, abdominal pain, rashes, conjunctivitis, confusion state, brain fog, bluish discoloration of the fingers, bluish discoloration of the toes, bleeding through the nose, bleeding through the throat, apart from the usual symptoms like sore throat, body aches, fever, loss of smell and taste. They all seem to be there.
So they're afraid in second wave because the people are not going to the testing center, the scene of the crowd, and a report is delayed.
Unfortunately, all testing centers, all labs, including ours, are absolutely overloaded. We are running a backlog of patients. Reports are not being able to be sent out within 48 to 72 hours. And looking at the crowd of patients and looking at the sudden rise in cases, I believe Delhi reported about 24,000 to 28,000 to 30,000 cases a day. All our labs in the city are not equipped to take such a huge load. We were not expecting this. Also, I would advise people to try staying away from crowded centers, because wherever there are crowds, there is a chance of spreading. And unfortunately, the new mutant seems to be extremely contagious, which spreads very easily. If I'm not mistaken, the Lancet India has also published a report saying that now the virus is airborne. So in crowded centers like this, where you're having tests done and where you're having people standing in crowds taking off their masks, that is a great risk. In fact, any crowded spaces.
How dangerous, and do you think that those people are waiting for their report and they are not followed COVID appropriate behavior, can be a spreader?
Yes, the second wave, as we can already see now, is extremely dangerous, and it is way more dangerous than the first wave that hit us. Unfortunately, in the second wave, the number of patients are huge. Our healthcare infrastructure is not up to date to handle the load. Unfortunately, as you've seen, we've run out of oxygen, we've run out of beds, we've run out of essential medications. At this stage, we are trying to figure out which direction the virus is going in terms of complications. We'll get to know that in a few weeks from now. The mortality rate seems to be increasing. As compared to the last time, the mortality rate is higher. Although I'll be cautiously optimistic and say that the mortality rate is still in control. A majority of patients are going back home. A majority of patients are healing well. It's a small group that goes to the ICU and unfortunately cannot make it. Like I said, I'm not downplaying it, but still so far I'm cautiously optimistic that the majority of people are healing. Now, when it comes to the role of people as super spreaders, yes, now that you see that this is such a contagious form of the virus and such a dangerous form of the virus, it is crucial for us to avoid crowds and avoid public spaces unless absolutely necessary. That would also include places for travel. If you are traveling, let it not be an unnecessary travel. When it comes to vacations, when it comes to group gatherings, please avoid it. It's just a few more weeks. We will hit a peak and we'll come into a plateau, then travel. But at this stage, avoid crowded places like airports, railway stations, shopping malls, or any group gathering for that matter. Please avoid it, because that will lead to a spread, because of this new variety is extremely contagious and also seems to be airborne.
Many people are suffering from vomiting and body ache. What you will advise to them, because they are not able to going to the RT-PCR test and they are sitting inside and isolate themselves in a house?
At this stage, unfortunately, due to our healthcare facilities being in shambles right now, it is crucial that when you get signs and symptoms, follow symptomatic treatment right away. It's crucial to understand that there is still no specific treatment for COVID. COVID is an inflammatory disease in which multiple parts of our body and organs are inflamed. It's crucial to treat the symptoms. It's crucial to treat the fever. It's crucial to treat the inflammation, the cough. And along with that, it is also crucial to make sure that your oxygen level is maintained, which happens in a majority of cases. It stays maintained. It's only in elderly patients mostly and patients with past history of pneumonia that the oxygen saturation will drop. So if you have simple symptoms, you will experience fever, body aches, dry cough, malaise, weakness, you will experience headaches, you will experience diarrhea and loose motions. All of these are easily treatable at home. Firstly, have a word with your physician, because it's based on your clinical history that your physician will give you certain medications. For example, everybody uses paracetamol. However, there are certain patients that may not be able to use paracetamol. Somebody with a past history of liver cirrhosis or any sort of liver issues or an allergy to paracetamol. So speak to your doctor, get a consult, and then start basic medications that can be easily treated at home irrespective of your RT-PCR. For example, I'll tell you some standard medications that can be used. You can always use paracetamol for your fever. You can use anti-inflammatories or pain medications for your body ache. You may need a combination of both. You will need to start a basic antibiotic for the upper respiratory infections, because to prevent any sort of pneumonia or complications of the lungs. You will require fluids, plenty of fluids. Keep your fluids high, keep your electrolytes high. Make sure you do steam inhalation, betadine gargles for your throat. These are all basics that can easily be taken care at home. Antibiotics are easily available in the market. You do not have to pop in ivermectin, you do not have to pop in Fabiflu, you do not have to especially run after remdesivir. Please note that remdesivir is only a drug which has limited use, and that too in severe cases and ventilated patients. Please do not start hoarding it. Leave it for the serious patients. It is not for everybody, and it actually has very limited use as per all medical journals that we are following. Okay.
One important thing is, in every hospital, every places, do you think what is the role of oxygen for the COVID patients?
Okay, oxygen is crucial. It's crucial for survival for everybody, and it's an unfortunate situation that we are in, that there is absolutely no oxygen around. However, we have to make do with what we have. I'm hopeful that oxygen will now be supplied. I do believe the government is doing quite a bit in supplying the oxygen cylinders all over the city right now, particularly here in Delhi. However, until then, you need to know that everyone does not need oxygen when it comes to being a COVID patient. If you've tested COVID positive, doesn't mean you have to hoard an oxygen cylinder at home. A majority of you will maintain your SpO2. As long as your SpO2 is maintained above 92, 93, it's all right. Expect a fall, expect a rise. There will be dips and rises, but that doesn't mean that is scary. If only you notice your SpO2 going below about 92 or 91% in room air for a couple of hours, irrespective of deep breaths, that's when you want to keep an extra oxygen cylinder around, or get some extra oxygen, or go to a hospital if possible, if there is availability. Also, at home, when you notice a slight dip in the oxygen, don't panic. There are a few simple things that you can do that can increase the oxygen level. These are things which we followed for a long time. If you've worked in the ICU as an intern or after that, these are simple steps we followed. First of all, you may have heard of the prone position, in which you basically lie down, and you lie down on your chest and you take deep breaths. Keep the chest a little high. What's the explanation of this? The explanation is rather simple, that when you lie down on your chest, basically your heart gives space to the lungs. It hits against the sternum, which is a rib cage, and it gives enough space for the lungs to expand. Also, when you lie on your chest, you actually have more blood supply to the backside of the lungs, which actually increases more oxygenation of the body. So a combination of increase in space for the lungs to expand and a combination of more blood supply to the backside of the lungs increases oxygenation in the body. This is a very common method which has been followed by years on, and so try doing that. Also, another very simple position would be the propped up position. When you do a propped up position, it's basically you lie in a 45-degree angle, keep two pillows behind your back and lie down. Increase the oxygen supply. You take deep breaths, that will increase the oxygen supply. Follow these two, and more importantly, please don't panic. Panic will automatically decrease your oxygen supply. So don't panic, rest. Not everybody will die of COVID just because you have it.
My final question to you, sir. 10 or teenage bar, what are the reasons behind to getting infection infections of children?
I believe it's possibly because of the new mutations that are coming in, the double, triple, and the ones which we have not yet decoded. Definitely seems to be affecting children a lot. I'm getting patients as young as 2, 3 who are coming in with symptoms and who are testing positive. The only good thing I can say is that the symptoms seem to be not severe. They are mild and moderate mostly. I'm sure there might be 1 or 2 symptoms which are severe. I have yet not seen any, but the symptoms overall seem to be limited to fever, body ache, and cough. All of them can be symptomatically treated at home by your pediatrician. Make sure you have a word with your pediatrician in terms of medication, but the simple symptomatic treatment which I just explained in the past actually can take care of children at home as well. You do not have to rush them to the hospital unless, like I mentioned, if there is extremely high fever of about 102 degree Fahrenheit or 103 degree Fahrenheit, roughly 39 degrees centigrade as well, which is not being reduced by paracetamol, that's when you go to the hospital. Or if your oxygen keeps falling to below 90-91 for over 2 to 3 hours, irrespective of the breathing techniques that I told you, that's when you rush to the hospital. Apart from that, expect your symptoms to go up and down for about 2 to 14 days. So don't panic if your symptoms still last for the 13th day, 14th day, and you say, I still have fever, it's not going down. It's alright, it'll be there. It's only when it crosses 102, 103 for about 2 to 3 days and it's not working with paracetamol, that's when you panic and go to the hospital.